Did you wake up with a headache this morning? Almost everybody has a headache at one time or another, except for one of our producers, Leslie. And most people's reaction is just reach for the aspirin bottle. And if that's your reaction, hold on just 1 second. Physical therapist Patrick Myers joins us with some exercises to exorcise your noggin pain. And Patrick, of course, there are different kinds of headaches. And you've brought one of your close friends here, although he looks like he needs to put on a little weight, to show us what cervicogenic pain is.
That's right. That means originating from the neck. So a lot of times people will have a headache and they'll go to their primary care physician and they'll be diagnosed with a stress-type headache or a migraine-type headache, and those have different definitions from the International Headache Society. Cervicogenic headache has a specialized definition as well, and it means its origin is in the neck, as I said, and it has to have meet 3 or 4 criteria. The neck, the upper neck, well, first of all, I think when you go to the doctor, you need to be screened out for your headache for any type of really serious or sinister type pathology that could occur or a disease state. Other than that, if they say, hey, this is a tension headache, this is stress in the neck, or these are typical migraines, then you might consider the cervicogenic origin. And what it means is these segments here, the skull and the first segment and the second segment, all have unique shapes and they all work together.
So that would be right about here at the back.
That would be right as you touch your head, you drop right off to that soft spot right there. Often these segments will not move correctly. And if you look here at this artery here, and you've got a whole bundle of nerves that come together and come out, plus you have a lot of tiny little muscles in this area. They all work together. If you have stress, it originates down here, comes up your head and into a headache. Now typically the upper 3 will give you a headache right over your eye, which acts just like a migraine. The middle segments will go more to the side of your head, so if you feel something just right over your ear or possibly right behind your ear. And really, you can even have headaches that generate from your lower neck or upper, what we call the thoracic spine, that come right up to the top and feel like a ball cap sitting on your head, just crushing it.
And there are exercises you say people should do before they reach for the ibuprofen.
Right, exactly. Some of these exercises are stretching these muscles gently, but I think one of the most common origins of this cervicogenic type headache is the muscles are so tight and consistent, and maybe someone has really bad posture where they're slumped down at the computer all day typing, and in order to see, they raise their head like that, which compresses this posterior aspect of the neck.
And I see athletes from time to time, maybe you've seen this too, who when they're not playing exactly, they'll be doing this. They'll be, just sort of moving their head like that. So what are some exercises we can do to prevent this?
Okay. Well, first of all, if you came into the clinic and we assessed here and we assessed one of these segments was the origin of the headache and it would produce the pain, and you'd say, hey, that's the headache pain I've got right there. What we would do in clinic is we would come, let me show you on here first. I put a towel around myself to protect myself from the patient, and I come around here and I put my finger right on the offending segment, and I can work that segment. So what I might do is just put a little, don't want to get you dirty, come right around here, hook my finger behind your head, and just put a little pressure there, and just a little bounce and a little glide. And so what we're doing,
I saw Mr. Spock do that on
and
Star
people
Trek
drop right to the ground.
Fall down there.
And what we do is we glide this segment. Once we get it to move appropriately, it's like if your elbow kind of gets stuck and you stretch it out and you feel better. Well, that segment's moving in this restricted area.
All right, cervicogenic headache. We're going to show you an exercise that you can do next time you get a headache that may actually help you without having to hit the medicine chest. So we'll do that when we come back. And if you want to get in touch with Patrick Myers at Apex Physical Therapy, it's at 141 South English Station Road. The phone number to call, 254-1136. Stay with us and we'll show you some more about headache. And still to come on. We're back with physical therapist Patrick Myers and some exercises to get rid of your headache without hitting the medicine chest. Patrick, show me what I should do.
Okay. I brought a little tool from clinic, and what we're going to do is we're going to put it right across this segment and help it move. And you can do this by yourself, okay? So you reach up, straight out.
Okay.
Make sure this runs right under your ear, right towards your nose.
Okay.
And then pull your head back into it like you're going to do it. Try to make a double chin there. There you go. Good. Easy, easy, easy. You don't need to pull very hard at all. It's just a nice, simple glide.
Mark Weinberg would not be able to do this because it would mess up his hair.
It looks like one of those Resist-A-Bands for exercising.
Right, but it's a solid strap, and what it's going to do is help that segment move forward and help it glide appropriately, so therefore you get better movement and eliminate those headaches.
And you can do that with a towel as well.
You can do that with a towel. You just take the edge of a towel and place it right behind your head, just like that, and then you pull back in.
Patrick Myers, thank you very much for coming in.
Yes, sir, I appreciate it.
Got our headaches out of here. How about that?
I know. Everyone gets headaches, and now there's some simple solutions.
Just about. Thanks
Thank
a
you
lot.
very much.
All right.